Diarrhea is a very common problem in children, particularly children less than 5 years of age, and it's a very important problem in India, and in fact it's one of the leading causes of death in children less than 5 years of age. It contributes around 10 to 15% of death in children less than 5 years. So it's very important to recognize the problem early and then to get treated properly. What we call as acute diarrhea, which means very short-term diarrhea, loose stools, or that can be a long-term diarrhea, the loose stools lasting for more than 2 weeks, 3 weeks, or even 4 weeks in children. So if you have acute diarrhea, just make sure you give your child adequate amount of ORS. ORS is oral rehydration solution, which is basically a powder which contains salt and sugar, and you mix it in the correct amount of water, which is given in the pack. It's a small packet, you mix it in 200 ml of water. If it's a large packet, you mix it in 1 liter of water, and then you see the nearest doctor if there is any problem for vomiting, not passing enough urine, getting very tired, or having weight loss, etc. But what I'm going to mention today is more about a chronic diarrhea, particularly if in babies less than 1 year. If the diarrhea is lasting for more than 2 or 3 weeks, you need to see a specialist soon. Sometimes the long-standing diarrhea can be just due to the diet based, because some people will taking too much of milk or too much of sugar, too much of fruit juices. This itself is result in diarrhea. Sometimes what happens, there could be infections. Actually, there's a lot of infections happening in our country. Virus infection is very common, or it could be due to bacteria, or sometimes rarely due to the antibiotics itself can cause diarrhea. If you're giving too much of antibiotics, these patients might need endoscopy, which is putting a special tube with a camera to check at this food pipe, stomach and intestine. Or also we have to check sometimes the lower part of the bowel, which is the anus, the large bowel and the small bowel also, which we will check through something called colonoscopy. If the diarrhea is lasting for more than 2 weeks, 3 weeks or 4 weeks in babies or in children, particularly if it's a blood or mucus in the stool, weight loss, or if there are other problems, you need to see the specialist soon. Thank you.